Hello, this is John KanellopoulosMD Center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center. This is a typical day in the office. We're seeing here, I think it already spanned through an AthensProtocol patient that we treated almost a month ago. So we're going to see the laser topography guided fix that we treat onto the bare epithelium, and then we do the PTK portion of the laser normalization. This is the keratoconus we're trying to correct, and this is a 50-year-old lady, so a person you would not expect for the epithelium to progress, the cornea rather to progress, but the epithelial maps did show in this patient that she had advancing keratoconus. We can see here when we were ablating directly on the epithelium that the cone area first clears up, then we're seeing the hyperopic arc, and we recently wrote a by invitation review of all procedures that have followed our paradigm of the Athens Protocol, all versions of Athens Protocol today. We've published almost half of the eyes in the literature that have received a combined customized ablation with accelerated CXL. The time in this treatment, and meanwhile I'm going to go and we're going to see before and after in a month, and we can see the drastic difference. The cone has flattened about 5 diopters, and what's very important, the upper area of the cornea that had flattened has been brought up over 3 diopters. So we have a normalization of over 8 diopters of the keratoconic step to create a almost normal cornea. And in this part, during the procedure, a little over a month ago, we're setting up the device to perform a PTK. Our go-to PTK would be 8 millimeters diameter, 40 microns, with the EX500 excimer laser. I use the same one in New York, and since we don't have a PTK mode there, I add 2.5 diopters of myopia on my topography guided fix, the Contura treatment, and then just treat under a different card, away from optimized, plus 275, and that accounts for the epithelial removal that you're seeing here, how nicely is using epithelium as a masking agent, and I'm getting a very homogeneous stroma area. And this, we're using mitomycin here for 60 seconds, 0.2%, a wet sponge with mitomycin. The patient is a little uncomfortable here, so I'm using just on the bulbar conjunctiva some extra anesthetic, and after that rinsing riboflavin, the Glaukos Vibex Rapid, so saline diluted riboflavin, not the dextran that unfortunately is the current FDA approved version. And we are able thus to treat this patient. Our epithelial maps today on this side are here. So we're seeing the epithelium is actively healing because of all the cross-linking shock. And as we taper steroids now, we expect this map to turn green, but we can also see the deep CXL line. We used here 10 milliwatts for 10 minutes instead of our classic 6 milliwatts for 15 minutes. And this is the application of the riboflavin solution. So the soaking is just 3 minutes because the cornea after the laser is already thirsty for the riboflavin solution. And what we're seeing here today, typically, is we're seeing some hyaline deposits and some difficulty in 1 to 2 eyes to reepithelialize. And I used a Q-tip, a sterile Q-tip that I had wet with afloxacin antibiotic to gently rub these off with no anesthetic and take out these hyaline bulbs, so freshen up the surface so it reepithelialize better. I'm going to close in, we saw the Pentacam maps, we saw the epithelium maps. Currently, we saw an example of some of the patients that do, and this is just one eye, take a while to heal. And you can see here how the epithelium remodeling on the patient preoperatively shows us that there was eye rubbing involved and this keratoconus was active. The irony is that the other eye of the patient has epithelialized same day, same treatment, very smoothly. There's no hyaline deposit in the center. So we are going to switch on a lighter steroid. We're going from dexamethasone to loperidol, and just twice a day we use autologous serum, vitamin C protection, in order to achieve the best possible scenario on this patient. We're seeing here the treatment of her left eye at the time, and again the epithelial maps of the right eye that we saw before pre-op, and the left eye treatment here with the excimer laser, trying to homogenize the surface. And this is the topo-guided treatment that will be done first on the epithelium and followed by the PTK 8mm 40 microns on the X500 excimer laser by Alcon. This is topography guided in order to get the normalization that we saw. Of course, we've published ray tracing data on these patients as well. And I think that the pictures speak on their own, and the fact that today's difference is so remarkable. This patient has improved in ghosting before and after, and the difference, and has a near uncorrected visual acuity of J1 plus, and distance with a -1.5 reaches 20/20, where her best corrected prior was 20/40. Again, this is John Kanellopoulos from a center in Athens, Greece. A little lengthy here, but I wanted to give you a recap of how we treat patients today with our AthensProtocol CXL. Of course, the choice of going higher fluence is the age of the patient. We said this is a 50-year-old something lady. On a younger patient, this was a 20-year-old male, we would treat the CXL part with 6 milliwatts for 50 minutes in order to get a deeper CXL line here in the stroma, and heavier on the stabilization of the cone rather than the normalization. Hope you found this interesting. This is John Kanellopoulos with some pearls on how to manage these patients in the early post-op area, rather the early post-op era, and avoid letting this heal on its own and had it being creating a scar. So polishing these hyaline deposits that kind of resemble tiny salzmal nodule, and the difficulty of the epithelium of reepithelializing here by the white spots. We're freshening the surface for the progenitor cells to come in, give us a clear epithelial surface, just like we have already in the right eye, and avoid any mishaps. Again, closing here, the left eye is going through the mitomycin C, will be rinsed, riboflavin solution, and then followed by, I'm going to fast forward this, by the accelerated CXL. Pictures of success, of a successful treatment. This is John Kanellopoulos. Thanks so much for your attention. Signing out from Athens, Greece.